Hi viewers, this is Koye Branch. In this video, I'm going to share information about cattle parturition or birth and stages of parturition. Cattle parturition or calving refers to the process of giving birth. The term calving is the specific term for the birth of a calf. And then the term parturition is a general biological term for giving birth. The calving process is a significant event in the life cycle of a cow, and understanding it is essential for proper health care and management. This process is generally divided into three distinct stages, each with its unique characteristics and needs. These stages include 1. The preparatory phase or dilation of the cervix, 2. The ejection phase or delivery of the calf, and then 3. The delivery of the placenta or ejection of the placenta. Knowing the normal birth process will help you decide whether or not to intervene in the calving or birthing process of a cow. Let us take a closer look at detailed explanation of these various stages. Stage 1, the dilation of the cervix or preparatory stage. In the early days leading up to the calving, there are several signs that indicates a cow is getting ready to give birth. These include changes in behavior, such as the cow becoming restless or isolating herself from the head. The cervix dilates and uterine contraction begin to move the fetus into position. Duration of this stage can last from 4 to 24 hours. The cattle may exhibit elevation of the tail, and then there is also an enlargement of the udder or the breast. At this time, a thick, clear mucus, commonly referred to as a string, may hang from the vagina. The cow's appetite decreases and she may prefer to be off-fed by herself. Uterine contractions begin by the end of this stage 1, pushing the uterine contents against the cervix, causing further dilation. Recognizing these signs is key to providing the appropriate care and environment for a successful calving. Stage 2, that's delivery of the calf or the ejection phase, usually lasting between 1 to 4 hours. The actual birth of the calf, known as parturition, is a critical phase where monitoring is essential. This stage starts with the cow experiencing contractions and ends with the delivery of the calf. At this stage, the cow usually lies down. This stage is characterized by appearance of the water bag through the vulva, signaling the start of labor. During this period, it is important to ensure that the cow is in safe, clean, and stress-free environment. While most cows will give birth without assistance, it is necessary to be vigilant and ready to call a veterinarian if any complications arises. The calf should be delivered within 1 to 4 hours of the appearance of the water bath. More recent research has found that healthy heifers with normal calf presentation will calf unassisted within 1 hour of the start of stage 2. A heifer is a young calf or female calf that has not given birth before. A healthy cow with normal calf presentation will also calf within 22 minutes of the start of the stage 2. Methods of presentation. 2 main types of normal presentations may be delivered vaginally during cattle parturition or birth. These are anterior or forward calf presentation and then posterior or backwards calf presentation. Anterior presentation is where the head and two front feet of the calf is resting against the underbelly of the cow's spine, comes out first from the pelvis. And then the posterior presentation is the situation where the two rear feet and a tail of the calf is resting against the underside of the cow's spine, comes out first from the pelvis. Other abnormal positions include, or other abnormal presentations may occur, such as the breech presentation. Here, the cow's back is against the mother's pelvis. And then another abnormal position is two front leg presentation. Here, the cow's belly is against the mother's pelvis with two front legs out of the cervix without the head may occur. If a calf is malpostured, such as the breech presentation or any other abnormal positions, a veterinary assistance may be required. If you are unsure how to correct an abnormal presentation, it is crucial to seek veterinary assistance. If the presentation is normal, you may allow the cow to labor for 40 minutes to an hour, especially if the water bag is still present around the calf. If the water bag is broken, the calf should be delivered sooner as long as the cervix is fully dilated. This stage 3, that is delivery of the placenta or ejection of the placenta. The placenta should shell within 8 to 12 hours of the calf's delivery. By definition, a retained placenta is one that is not shed after 12 hours. If retained, do not forcibly remove it. The cervix remains open as the placenta membranes keep it open. This is a good thing, as healing occurs under aerobic conditions to slough the placenta out in 4 to 7 days. Administration of injectable antibiotics may be warranted if the cow develops fever. After the calf is born, attention must be focused on ensuring the health and well-being of both the mother and the newborn. These include monitoring of the cow for any post-birth complications and ensuring that the calf is nursing properly. First few hours after birth are vital for the calf to receive cholesterol, the first milk rich in antibiotics or antibody nutrients. Related complications. The related complications which may arise during birth, delivery, or parturition include dystocia and retained placenta. Dystocia means difficult birth. It requires more attention and labor during birth. Dystocia can lead to death of either the mother or the fetus. Conditions leading to dystocia include induction of parturition or artificially starting birthing process, multiple births, premature or late births, incorrect fetal presentation, incomplete cervical dilation or small cervix, and then vaginal fear. Retained placenta. Here, the placenta stays inside the body or uterus of the cow. This affects the health of the cow, and this condition also leads to delayed conception of the cow. And then it may lead to high treatment costs for the farmer. Factors causing placenta retention include dystocia, inflammation of the placenta, milk fever, or lack of calcium to help muscle contractions, induced calving or parturition, and then mineral deficiencies such as selenium, vitamin A, and vitamin E. Another condition is hypoglycemia. It's a condition characterized by low blood sugar, typically below a certain level. And then its symptoms is like sweating, shaking, hunger, and headache. In summary, therefore, stages of parturition include the preparatory phase, which lasts 2 to 6 hours. Here, the cow's cervix starts relaxing and uterine walls contracts. Cow becomes restless with signs of pain. Fetus move into normal birthing position, head and legs towards the cervix. Then to the ejection phase, which lasts for 1 to 4 hours. Here the cow usually lies down. Diaphragm and stomach muscles contract to assist uterine walls to push the fetus out. Amnion breaks when four limbs of fetus move through the vulva and then placenta stays behind. Then the third stage, which is expulsion of the placenta, this occurs within 1 hour after birth, a short period of rest after birth, where parastatal contractions expel the placenta from the uterus. This is the conclusion of my video. If you have any comments, please drop it in the comment box and stay tuned for more educative videos. Thanks for viewing and bye-bye.